Chapter 3 Methods of Cupping Therapy. There are various methods of cupping techniques being used throughout the world, but the two common ones are wet cupping and dry cupping. In this section of the audiobook, we are going to explain the difference between the two. Dry cupping. Let's start out by explaining what dry cupping is. Dry cupping is the basic and most common technique that is used. Here, cups are used to create a vacuum over your skin. A combustible material, such as herbs, alcohol, or paper, will be lit and put into the cup. As the fire goes out, the cup will be placed over the selected area. The cooling air that is inside the cup will create a vacuum, which causes the blood vessels under the skin to redden and expand. The cup may be placed here for up to 10 minutes. In another variation of dry cupping, the cup will be held over a flame to heat the air inside it before it's placed on your skin. Many therapists choose to place a piece of insulating material over the skin and place the lighted material on it before inverting the cup. Don't worry, because this will extinguish the flame right away, so it's not going to burn you. Most who use the dry cupping method use glass cups because they are durable and easy to sterilize. Plus, they create a perfect seal. Wet cupping. This is not used in traditional Chinese medicine, but is still popular around the world. Some studies show it to be more effective in treating some problems, such as migraines, nonspecific lower back pain, and postherpetic neuralgia. As to its other acclaimed health benefits, on the other hand, those remain in contention. Nevertheless, there are clinics throughout Europe and the Americas which do provide wet cupping services under sterile medical conditions if you're interested. Although it requires bleeding, it should be understood that it is not the same as bloodletting. Bloodletting requires the opening of veins by cutting them with a scalpel, puncturing them with a needle, or by using a leech applied to the skin. This extracts blood with tiny incisions to the skin surface after cupping. In the UK, the clinics that provide this service make use of sterile plastic cups, which are disposed of after each use. The patient's back is first sterilized with alcohol, after which oil is rubbed on the shoulders as well as the upper and lower back. In the beginning, suction will be created similarly as to dry cupping, but instead of leaving the cup on for 10 minutes, it will be left on for about 3 minutes. Next, the therapist will take a scalpel to make minute incisions on the skin. During this time, a second cup will be placed on the area in order to suck up a couple of drops of the toxic blood and the harmful substances from your body. This will allow the healing to take place. When completed, you will be dressed with antibiotic ointments, and sterile bandaging should be applied in order to prevent infection. Wet cupping may sound scary, but it isn't as painful as you may think it is. Needle retaining cupping. Needle retaining cupping is another form of cupping that we feel the need to discuss. This method involves a combination of acupuncture and cupping. Attach a cup to the area around one or more of the retained needles and keep the needles inside the cup. Remove the cup and needles after 5 to 10 minutes or when the localized skin becomes red. Cupping, both wet and dry, is an ancient technique still practiced today by millions. Recently, celebrities have even taken it up, increasing its popularity further. Dry cupping raises few eyebrows, in addition to the ugly bruises it leaves behind, that is. However, there have been no reports of any complications arising from cupping sessions. As such, it's generally safe, if done properly. There are even home kits that you can buy so you can do it on your own in the comfort of your own home. If you remember the 5-minute rule and do it no more than twice a week, you should be good to go. As for wet cupping, well, you're on your own there. Under the right conditions, it can be perfectly safe, and it can't possibly be worse than some of the other alternative methods available.